My name is Maria. I'm married and I am a mother of three young adults. As a child, I developed rheumatic fever, and as I got older, I developed aortic insufficiency due to that. And at the age 15, I had my first open heart surgery. At the age of 28, I got married, became pregnant with my first child, didn't have any issues, became pregnant with my second child, didn't have any issues, everything was normal. And then the third pregnancy, that was different. At 28 weeks, I developed congestive heart failure. I was running out of breath. My sister had told me that maybe it was my heart. She did everything, and it did show that my aortic valve was not functioning right and that I needed to be admitted at 28 weeks pregnant. The doctors, between other providers, OBGYN, cardiologists, surgeons, were trying to decide what they needed to do first. Was it get the baby out first, or have my open heart surgery first? They all came in to give us the pros and cons and the risk of it, there was a possibility of either the baby or myself dying on the table. I knew what it took to have a procedure, but just hearing it from the doctor, it's just like, this is real. They did the C-section first, and the baby came out crying. They didn't need to spank him or anything. He just came out hollering. He was taken to the NICU unit. Then they started doing the open heart surgery. So I came home, and they called me from the hospital. Mrs. Dominguez, you need to come get your baby because he's doing really good and I believe he's ready to go home.
Dr. Toll and I both began in Norman in 1991 and worked together for 30 years. He was not only an excellent surgeon, but a wonderful guy, which I think any of his patients would attest to. He really took a big interest in his patients. He would want to learn about them, about their families, about their profession, before he ever even talked to them about their medical condition or what he needed to do, which was very unique and put the patient at great ease.
So I went in for 2 post-op visits, I believe I remember right. And at one of those, he told me that my new aortic valve was as good as a Chevy engine or Chevy motor, but it was a Chevy case. So, and that it will be good for a long, long time. And here I am.